Hey there, friend. Welcome to this complete guide called High Blood Pressure Explained. I'm so glad you're here today, taking a little time for your health. Imagine this: you're in your 40s or 50s, busy with work, family, maybe scrolling on your phone late at night. Lately, you've been feeling more tired than usual. Headaches come and go, especially after a long day. You chalk it up to stress or not sleeping enough. You figure, I feel okay most of the time, so it's probably nothing serious. But one day at a routine checkup, the doctor says your blood pressure is higher than it should be. It catches you off guard because there were no big warning signs, just those everyday little things we all ignore sometimes. That's the reality for millions of people. High blood pressure is often called the silent issue because it can creep up without making a lot of noise. But here's the good news: understanding it early can make a huge difference in how you feel day to day and protect your health long term. It's not about scaring you, it's about empowering you with simple knowledge so you can take control. In this 1 to 2 hour guide, we're going to break it all down in easy, everyday language, no complicated medical jargon. You'll learn what high blood pressure really means, like how your blood pushes against your arteries a bit too hard, kind of like water pressure in a garden hose that's turned up too high. Why it can change over time, things like getting older, daily habits such as what we eat or how much we move, work stress, not getting enough good sleep, or even family history playing a role. The subtle signs or body changes you shouldn't brush off, like feeling unusually tired, occasional headaches, or other everyday signals that might point to it. And most importantly, the general steps you can take to support your health, small, realistic changes in diet, movement, and habits that many people find helpful. Remember, this is all general health education to help you be more aware. It's not personal medical advice. Always chat with your doctor or a qualified healthcare professional about your own situation. They're the ones who know your full picture. If that story I shared earlier sounds a bit like you, maybe you've noticed more fatigue after busy days, or you've put off a checkup because everything seems fine. Pause for a second and think, when was the last time you had your blood pressure checked? No judgment here, life gets hectic. Drop a comment below if you've ever ignored a little body signal like that. You're not alone, and sharing can help others too. We'll cover everything step by step, with real-life examples from things like grabbing fast food on the go, sitting at a desk all day, or dealing with family stress. And I'll throw in moments for you to reflect, because this is your health journey. Stick with me. By the end, you'll feel more confident about what high blood pressure is, why it matters for your energy and daily life, and what you can do about it. Let's start with the basics so you can understand what's really happening inside your body and why it matters for your daily life. Now that we've hooked into why this topic is so important for so many of us, let's dive into the fundamentals. First, what is high blood pressure, in the simplest terms? Think of your heart as a pump and your blood vessels as pipes or hoses carrying blood around your body. Every time your heart beats, it pushes blood through those vessels. Blood pressure is just the force of that blood against the walls of your arteries. Normal pressure is like a gentle flow, enough to get nutrients and oxygen everywhere they need to go without straining things. But when it's high, it's like turning up the faucet too much. The blood pushes harder against the artery walls over time. This can make the heart work harder and potentially lead to wear and tear on your vessels and organs. Most people don't feel it day to day, which is why it's silent. But if it's consistently high, say, readings around 130/80 or above on average, that's when we call it high blood pressure or hypertension. It affects how you feel in subtle ways: less energy for daily tasks, maybe poorer sleep, or just not feeling as sharp. Over years, it can quietly add stress to your heart, brain, kidneys, and more. Next, let's talk about the signs and changes you might notice in your daily life. Remember, many people have zero obvious symptoms. That's why regular checks are key. But here are some common ones, broken into a simple list: mild, everyday changes that could be early signals: feeling more tired than usual, even after a full night's sleep, like dragging through your afternoon at work. Occasional headaches, especially in the morning or after stress. A bit of dizziness when standing up quickly, or blurry vision now and then. Moderate problems that might show up over time, shortness of breath during normal activities, like walking upstairs or carrying groceries. Chest discomfort or tightness during exertion, not sharp pain, but a heaviness. Swelling in your ankles or feet from fluid buildup. And serious warning signs, these mean get professional help right away: severe headache with confusion or vision changes. Chest pain that feels crushing or spreads to your arm/jaw. Sudden severe shortness of breath or fainting. If any of these ring a bell, especially the serious ones, please reach out to a doctor soon. This is general info. Your healthcare pro can sort out what's going on for you. Think about your own routine for a moment. Have you noticed more tiredness lately, maybe tied to late nights or busy days? Or headaches after salty meals? Jot it in the comments, it might help someone else recognize their own signals. Now, onto the key causes and risk factors. These are the everyday things that can push blood pressure up over time. Some you can't change, like age. As we get older, arteries naturally get a bit stiffer. It's common after 50 or so. Family history: if parents or close relatives had it, your chances are higher. Certain backgrounds: it's more common in some ethnic groups, like African heritage. But most risk factors are lifestyle related, and these are things we can influence: sitting too much or not moving enough, desk jobs, screen time. If we're sedentary most days, it adds up. Diet heavy in processed foods, salty snacks, fast food, or sugary drinks. Too much sodium makes your body hold on to water, raising pressure. Being overweight: extra weight means your heart has to pump harder. Smoking or too much alcohol, both tighten blood vessels temporarily and damage them long-term. Chronic stress: work worries, family stuff, constant stress hormones keep pressure elevated. Poor sleep: less than 7 to 8 hours regularly, or interrupted sleep, can contribute. Existing conditions like diabetes or high cholesterol, they often team up with high blood pressure. Real-life example: picture someone with a demanding job, grabbing takeout because they're rushed, staying up late scrolling, and not exercising much. Over months or years, these habits can nudge numbers up without noticing. The good part? Many of these are adjustable. Small shifts can help. If any risk factors sound familiar, like long hours sitting or loving salty chips, that's okay. Awareness is the first step. Comment below, what's one daily habit you think might be affecting your energy or health? We've covered the basics, signs, and causes. Next, we'll talk about how this is usually checked and what ignoring it long-term might mean, gently, with focus on prevention. If any of these signs or risk factors sound familiar from the last section, you're probably wondering, how do doctors usually keep an eye on this? In general, high blood pressure is checked with a simple, painless cuff around your arm. You've probably had it done at checkups. It gives two numbers: the top, systolic, when your heart pumps, and bottom, diastolic, when it rests. Normal is under 120/80, elevated starts around there, and higher needs attention. Many places recommend checks every couple years starting in adulthood, or more often if numbers are borderline or you have risks. Doctors might ask about your lifestyle, diet, exercise, stress, family history, and sometimes do blood tests for related things like cholesterol or kidney function. Home monitoring is common too. Affordable devices let you track trends. But always share readings with a professional for interpretation. This is general, no must dose here. Your doctor tailors it to you. Now, gently, what if high blood pressure goes unchecked long-term? Over time, that extra force can strain your heart, making it thicker and less efficient, leading to fatigue or heart issues. Vessels can harden or narrow, affecting flow to organs. Common long-term concerns include more tiredness, circulation problems in legs, kidney strain, since they filter blood, or risks to eyes and brain. It's not meant to worry you, most people manage it well with awareness. The key is early action to avoid these. Pause and reflect. Have you had a recent checkup? If not, maybe think about booking one soon. It's quick and gives peace of mind. On the bright side, prevention and early steps are powerful. General ways people support healthy blood pressure: regular checkups to catch changes early. Tracking numbers over time with a pro's guidance. Improving diet: more fruits/veggies, whole foods, less processed/salty stuff. Moving more: simple walks, daily activity. Managing stress: deep breaths, breaks. Better sleep routines. Quitting smoking, moderating alcohol. And always follow professional guidance. They might suggest options based on your needs. Remember, this is educational info only, not personal advice. Consult your healthcare provider for your situation. We've built a solid foundation. Coming up, a fun engagement part with tips and questions to keep you going strong. Alright, friend, we've covered a lot so far: the basics, signs, causes, checks, and why early awareness matters. How are you feeling about it? Take a breath. You're doing great by watching this. Let's pause the heavy stuff for a bit and make this personal. I want to hear from you. Think about your daily routine. How's your sleep? Do you get 7 to 9 hours most nights, or is screen time cutting it short? Diet-wise, how often do you grab processed snacks or eat out? Be honest, no shame. Movement: are you sitting most of the day, or getting in walks? Stress: work, family, worries, does it keep you up? Habits like smoking or alcohol, anything there? And checkups: ever delayed one because I feel fine? These are gentle questions. Reflect quietly or comment below. Sharing experiences helps the community. I cut sugary drinks and felt more energy, or stress from my job spikes my headaches. Your stories inspire others. Comment one thing from your routine, or a question about habits. Quick wins while we're here: mini habit: add a 10-minute walk after dinner, boosts mood and circulation. Easy change: swap one salty snack for fruit/nuts. Stress tool: try 4-7-8 breathing, inhale 4 seconds, hold 7, exhale 8. Do it now with me. Great for quick calm. Sleep tip: dim screens an hour before bed. These small things add up without overwhelm. If you're enjoying this, hit like. It helps spread reliable info to friends/family. Subscribe for more simple health guides, and turn on notifications. In a few minutes, as promised, we'll dive into a realistic plan: foods that support you, movement goals, stress tools, and FAQs to clear myths. You're halfway. Keep going. The practical stuff ahead will give you actionable steps. Now, as promised, let's go step by step through what you can actually do in your daily life to support your body and protect your health. This is a realistic lifestyle approach, not a strict diet, but balanced habits many find helpful for blood pressure. Always discuss with a professional. This is general education. First, diet: focus on whole foods. The DASH approach, dietary approaches to stop hypertension, is evidence-based, rich in fruits, veggies, whole grains, lean proteins, low-fat dairy, healthy fats like nuts/avocados. More: 4 to 5 servings fruits/veggies daily, apples, berries, leafy greens, potatoes. Fiber from oats, beans. Lean proteins: fish, chicken, beans. Healthy fats: olive oil, nuts. Less: added sugars, sodas, sweets, refined carbs, white bread, salty processed foods, chips, canned soups. Aim under 2,300 mg sodium/day, ideally 1,500 mg. Example day: breakfast oatmeal with berries, lunch salad with grilled chicken, dinner salmon, veggies, brown rice, snacks yogurt or nuts. Do: read labels, cook at home more. Don't rush, start by adding 1 veggie per meal. Movement: aim 150 minutes moderate activity/week. Simple: brisk 30-minute walks most days. Add light strength, bodyweight squats, resistance bands, 2x/week. More daily steps, park farther, take stairs. Stretching or yoga for flexibility. Build slowly, even 10 minutes counts. Sleep, quality matters. Routine, same bedtime/wake time. Wind down, no screens 1 hour before. Cool, dark room. Aim 7 to 9 hours. Stress tools, breathing exercises daily. Short breaks, walk, stretch. Social support, talk to friends. Hobbies, nature time. Routine checkups, discuss numbers regularly, track progress. Do's, build habits gradually, celebrate wins. Don'ts, avoid extremes, no crash diets. Reduce smoking/alcohol if applicable. Now, FAQs and myths versus facts. If I feel okay, can I still have high blood pressure? Yes, it's silent, checks catch it. Can lifestyle changes really help? Absolutely, many lower numbers with diet/movement alone. Is it only for older people? No, can start younger with habits. All salt is bad? No, reduce processed, sea salt same sodium as table. Wine is good for heart. Moderate maybe, but not for pressure control primarily. Natural supplements safe instead of meds? Not always, discuss with pro, some interact. Family history means I can't prevent? No, lifestyle reduces risk a lot. Myth, it's just stress, it'll go away. Fact, chronic, needs management. Always personal advice from doctor. This plan is flexible, start small. We've reached the end, thank you for sticking with this full guide. Quick recap, high blood pressure is extra force in arteries, often silent, affecting energy and organs. Signs, from mild fatigue/headaches to serious warnings. Causes, age, family, but mostly lifestyle like diet, inactivity, stress. Checked simply with cuff, long-term strain on heart/kidneys if ignored. Prevention, checkups, healthy habits. Practical, DASH-style eating, movement, sleep, stress tools, FAQs cleared myths. You're empowered now. Realistic start this week plan, schedule or note next checkup. Add 1 walk daily. Swap 1 unhealthy snack for fruit. Try earlier bedtime one night. Cut 1 sugary drink. Small, consistent changes make big differences over time. Be patient, your body thanks you. You're capable of great health shifts. Feel hopeful, many thrive managing this. For more, like/subscribe/notifications. Check related videos, understanding your daily health numbers, and simple habits to support your heart and energy. Thanks for your time, care for yourself with kindness. See you next.